This
is Journal
club.
So, our bodies are a wonderful concoction of hormones and glands that produces hormones.
These hormones are necessary to regulate all sorts of bodily functions.
Like everything.
Like literally everything.
Yeah.
Sleep, temperature, heart rate, digestion, breathing.
Yeah.
Stress.
Bladder control, milk production for
Love.
pregnant moms.
Pregnancy.
Hormones are very important, guys. That's why any disease that messes with your hormone production is pretty devastating. It affects your quality of life very much, right?
I would say my favorite part of the endocrine system is definitely the thyroid. I would hate if there was some autoimmune disease that was affecting it.
There are quite a few actually. Now that you bring that up, okay. Anyway, so there's this one condition called hypothyroidism or chronic thyroiditis, also known as Hashimoto's. That has a lot of hats.
So what about it is bad? How do you develop Hashimoto's or this chronic thyroiditis?
Well, Hashimoto's is a genetic disorder that mainly affects women, mostly affects women.
Oh, phew.
You're not entirely safe though. It also has environmental triggers and risk factors, but the main problem is hypo, meaning under, and thyroidism, so condition of thyroid, is it's basically your thyroid underproduces T3 and T4, and therefore, as a result, your metabolism and temperature regulation, things like that, are inhibited. And usually people with hypothyroidism, run cold and have weight gain issues, or weight loss issues. They gain weight, they can't lose. Both issues, I guess. But
So this Hashimoto's, it's an autoimmune disease. So the thyroid is experiencing fibrosis, it's getting degenerated, and that causes underproduction of these key thyroid hormones.
Yes.
Right? And that leads to all these horrible symptoms.
that greatly reduced quality of life, and it's an autoimmune condition, so decreases the efficacy of your immune system to fight other normal conditions, the flu. Things like that.
So is Hashimoto's a one-time thing or is it chronic?
It's an autoimmune condition. Once you develop it, you're kind of fucked.
Okay, sorry. A better question is what do people currently with Hashimoto's what do they have to do to regulate their
Right, so
I think just supplements, right? Taking.
Yeah, there are a lot of lifestyle changes, and you have to change your diet, and usually, iodine is things in shrimp and seaweed and stuff. You have to change the amounts of that, either increase or decrease, and exercise more and optimize your diet because it's so difficult to maintain a healthy weight when your metabolism is significantly slower because your thyroid isn't producing enough of the hormones. There are some novel medicines. You can take injections. There's one that's a synthetic thyroxine hormone. It's called levothyroxine, I believe. And it is fairly effective. And I wouldn't say it's too pricey. It's, according to Google, it ranges from $12 to $270 per month. So you can choose where, it's general versus brand name. But, and it's shown to be pretty effective, but there are of course side effects, and you have to take injections very regularly.
Basically, it is a sort of manageable thing, but you're going to be living with it your whole life. You will have to think about it your whole life.
Yeah, it doesn't solve the problem. It treats the symptoms, not the cause of the disease.
Right. So
what can you do about that?
Yeah, what can you do about that? I've been hearing a lot of talk recently about these things called stem cells, and they're kind of everywhere in medicine, right?
Yes.
So I'm curious, do you think stem cells, let's introduce, what are stem cells?
Undifferentiated cell.
So you can think of them like baby cells that can turn into basically almost
any type of somatic cell.
Yeah, depending on the type of stem cells. But I was thinking could this be used to maybe regenerate thyroid tissue or fix your thyroid almost to solve Hashimoto's or other chronic.
That's exactly what we've been
That seems pretty straightforward. Just take some bunch of undifferentiated cells, throw it in a broth with some factors that make them turn into the cells that are normally presented on the thyroid, put it in, and you're done. Or what are some issues that obviously are preventing this from just going mainstream?
Wait, where are the issues?
I think issues, for one, the thyroid tissue is pretty complex. It's not just one type of cell.
And there's the parathyroid, which works in conjunction with it.
Yeah.
Like little butterfly things at the top.
So even if you can like differentiate these thyroid cells, or like
Yeah, there's no saying it's going to produce the right amount, I think is a big problem. Yeah, even if you specialize it and it's like, okay, you're a thyroid or you're a parathyroid like cell now, okay, produce this. I mean, there's no regulation. It could just become, it could undergo fibrosis again and just be the same thing. So there's limited like regulation and long-term effectiveness.
yeah. I also think like they've shown that in the past mice like in vitro and in vivo studies, they have been able to generate like functional thyroid tissue, but there's no saying like, it's like how people have been able to generate brain tissue, but you wouldn't like, there's no showing that it would function well in a human system.
But do you think there's like a compatibility issue?
Maybe. I mean, you could take the stem cells from your own body, right?
I suppose,
It
but given that I assume they're cultured in outside environment,
Mm-hmm.
and putting them back in, there could be some. Your body just might think they're foreign and attack it.
Mm-hmm.
Mhm.
Yeah, you could create the thyroid tissue and then inject it, and then is rejected, and it becomes like a tumor or something, and that greatly inhibits even more production of the hormones. So yeah, there's a lot of issues. It is definitely a new thing, but I think like most stem cell research, it's very promising to treat inflammatory related diseases.
Mm-hmm. So when I'm getting TLDR, there is a lot to show from stem cells. It could potentially be a cure, and there's some research showing that, like, yeah, it's possible, but just a lot of future trials, a lot of future experimentation, like clinical implementation even, is needed before any definitive like solutions come to market.
Yeah, and even if we figure out how it works, I mean, we're going to need like regulatory medicines and things like that.
Because one of the big conversations around stem cells is, oh, how can we make sure like we're using them ethically and sourcing them in a normal way? Because there's like different tiers of stem cells, right? But the most impressive ones are embryonic stem cells, because they can truly differentiate into anything. But as the name suggests, they're only present in embryos. So, like, is there an ethical way to source embryonic stem cells from embryos?
Just like an embryonic stem cell farm.
Yeah, you're like farming embryos. Just the sound of that, like clearly something, or like some regulation or some sort of like conversation.
Yeah. So in the meantime, I mean, there are current.
I think they just figure out how to actually do it first
before getting to the farms.
we can worry about that later.
Yeah, this is definitely going to be a long road, like most stem cell research, but it definitely is promising because, like I said earlier, it'll treat the disease, not the symptoms. So, and could also be kind of preventative for people who are at risk genetically.
Okay.
Yeah. Dude,
Pretty
could you imagine, like, if you're at risk for hyperthyroidism or something, and then as an embryo they harvest your stem cells and like keep it in stock for years to come? Because like the whole thing of stem cells is like, if it's from your cell.
Yeah.
It's been interesting. Food for thought.
Metabolism is so like misunderstood or understood. I don't know if that's a word, but we don't know a lot about it. And especially because your metabolic rate, well, okay, it's not just like digesting food and stuff, it's also dealing with all of your cellular functions as metabolism. But the rate changes based on where you are, like age-wise, like biologically, like, you know what I'm saying? So depending on, I guess if you take it, I don't know, it's interesting to think that if you take it from a certain like age or inject it at a certain age where you're not like just like 60 plus, then there could be a lot of interesting effects.
You're like 65 with a super functioning thyroid.
Yeah. Well, that could just be hypothyroidism, which is also a problem. But because when you're a baby, I mean, your cellular function is very high. I mean, you're dividing and growing and whatever. And when you're older, they say that after you're like 20, 25, your metabolism decreases by 10% per year. So which makes sense. I mean, you also get more diseases and things. Your cells begin to be less good at their jobs. But it's interesting.
Interesting.
Food for
Yeah. There's a whole world out there. I was gonna go up again.
So cringy.
No.
Let's all signing off. Wait, no, we have to go in order. Like,
What's the order?
Kevin Chen signing off.